Hello, this is me, Jennifer Cabilas Paglinawan, and I'm going to present today my teaching demo. The topic that I'm going to present is about types of wound dressing, classification of wound and dressing products. So the teaching strategy that I'm going to present or to show to my 20 newly hired nurses is about it's the lecture. Okay. To begin with, these are my 20 newly hired students behind me. So here they are. They're waiting for me to start the lecture. And I'm going to use a projector to present my lecture. Okay, how are you guys? Fine. Good. Welcome to my lecture. My name is Jennifer Paglinawan. So today I'm going to present to you about types of wound dressing, classification of wound dressing and product. So I know this is very common in our website, and I just want you to be familiar with different products that we use on the floor. So my objectives is kailangan ko pala muli. May magpindot-pindot tubig. Record doon. Sorry. Dapat tak-synchronize siya doon.
Enter na.
Enter mo lang. Ganun.
Kung ano doon, dito na.
I'll give you So my objectives, I have 5 objectives here. First is to identify types of dressings. Second, demonstrate the selection of dressings. Be acquainted with yourselves with dressing categories and moisture, then identify formulary of product groups with recommendations. And lastly, determine different dressing materials. So types of dressings. So we have an open dressing and we also have closed dressing. So depending on the type of the wound that we're going to use. So dressings, we have dry and we have moist. So depending on the wound that we're going to apply, so we have wound that a lot of exudates. So first we have to use product that really absorb the exudates or absorb the moisture. And then we also have dry, for like abrasions or lacerations. So we will apply the dry dressing. Debridement. I know everyone of us know what debridement, right? Um, what do you understand about debridement?
Excess
Yeah. Yes, yes, yeah, correct. Okay. So basically, debridement is like medical removal of the necrotic tissues in order to promote healing of the wound. And there are different kinds of debridement. We have enzymatic. Enzymatic is kind of debridement that medical staff is using kind of enzymes to promote healing. So one of this is the what do you call that? Oh my god. Huh?
back machine.
No, it's an ointment. Yeah, there's a certain ointment that staff nurses or the doctors are using
Honey.
for not honey, so it's called wipes. And then another one is the surgical method of debridement, wherein this is the most effective, but it will cause bleeding to the wound. First, the doctor or the podiatrist and the physician will really use scalpel or curette just to remove all the esters. Next is the mechanical. This is the efficient and the fastest kind of debridement in which The medical staff will just put in irrigation. It uses wet and dry dressing, and then you put a gauze. It's a wet gauze, and you just apply on the top of the wound, and then you will remove the dressing, and then wait, when you remove the when you remove the gauze, all the esters will be removed, and then that's the process when you debride it. And lastly, it's the alternating. Selection of dressing. So it should be recognized that wound will require treating differently at various stages of its healing. So no dressing is suitable for all wounds. So obviously, it depends on the wounds that you will apply it depend on the kind of dressing that you're going to apply to the wound. So it depends on the wound. So sometimes we let the wound to just heal without the dressing, like just open it on the air just to let it dry. And sometimes if it's really soaked with exudates, you have to apply with foam just to absorb and let it dry. So moisture management and wound healing. A moist wound healing environment prevents cell dehydration and death. Promotes angiogenesis. It's angiogenesis. Angio is the vascular, genesis is the growth. It's like a growth of new skin cells, new vascular angiogenesis. Improves skin, improves phagocytosis, and growth factor elaboration. Next is moisture improves the rate of re-epithelialization, reduces pain, and improves cosmetic outcomes. Too much moisture causes maceration. Maceration is like it's over soaked. And then too little causes desiccation. It's too much dry of the wound bed. So just enough moisture is good. Too much is also dangerous. Remember, select the dressing to match the appropriate wound and individual person characteristics, healable, maintenance, or non-healable. So you have to remember this acronym in order to choose the kind of dressing. So the dye, D for debridement, I for infection or inflammation, moisture, and then E for the edge. So the type of moisture that is dry or wet, and then the edge. Clean. So there is a debate when before you start with your wood dressing, what you're going to use, is it sterile or clean? There is a debate that people, nursing staff are going to use a sterile technique or it depends on the cell. Exactly. So of course we don't want to have it to make it happen that the patient will have infection. So instead of debating clean or sterile technique, adoption of universal practice using principles of aseptic technique is more appropriate. Asepsis is taking necessary measure to prevent contamination of the wound through preventing cross-contamination of the wound. The level of asepsis should increase as the procedure becomes more invasive. So the more invasive it becomes, the more high level of aseptic technique we use. Cleansing with remove all dressing. So these are the steps on how to cleanse the wound of the patient. So first, remove all dressing, and then wash very wound skin, and then pat the skin dry. Clean wound with normal saline. Usually, we're using the normal saline, right? And there are also other solutions that most commonly is the normal saline. And then the best way to fully cleanse is use a 30 cc syringe filled with normal saline. 30 cc, just to put pressure to the wound, like will remove all the debris. For a small wound, you can use 10 cc, big wound 30 cc, refill syringe with normal saline, and then pat the wound dry. So these are the products that we usually use on the floor. I know this is familiar to you. Yeah, so we have betadine. Here we have hydrogen peroxide, and we have so these are the dressing that we're going to use. Did you see this arrow? This is the absorbency of the dressing. So did you see it increases? So if it's there are a lot of exudates, we're using the foam. If it's only less or it's dry, we're using the transparent film. So neither absorb moisture, so transparent film. So we have Tegaderm, right? And then hydrogel, hydrocolloid, donates absorbs small to moderate amount of moisture. Alginate for the moderate to large, and this one is for the moderate to large amount of moisture. Formulary of products, groups with recommendations. So these are the products that we have in our guideline. It's available. Alginates, calcium alginate. You guys familiar to you? And then it's indicated in the management of moderate to heavy exuding wounds. So it's not going to be used for the dry wounds. Absorb small to moderate amounts of exudate, like 20 times their weight in fluid. Calcium alginate is a sodium alginate, active in static dressing. So if the wound is bleeding, so this is the product that we're going to use. Then the fiber convert to a hydrophilic gel. It's biodegradable when in contact with exudates. Avoid packing in deep narrow sinuses. Of course, it will block our airway. So this Tegaderm alginates. Home dressings. It's indicated for medium to heavy exudate wounds. Exudate absorb horizontally across the hydrophilic surface. It has a low adherence. So guidelines for use: place on wood surface secured with adhesive tape, and then change every 1 to 7 days depending on volume of activate. So we have example, these are the example. We have the Mepilex border, sacral foam, we have the heel foam. These are our foam dressings. Hydrocolloids. Indicated for low or medium exudate wounds may contain gelatin, sodium carboxymethylcellulose, and textine with flexible water-resistant outer layer. So it has water binding and water repelling components. So when you shower the patient, it's okay because it doesn't get wet. Hydrocolloids, it protects skin from friction and shear, aids autolytic debridement, should not be used in fragile skin, heavy exuding infected wounds. Gives odor that confused with infection. So do not get confused because it has this smell. Thickness, size, absorption varies. Wear time up to 3 to 7 days. Brushing should extend at least 2 cm beyond the edge of the wound. Hydrocolloids. So these are the pictures of the hydrocolloids. We have this on the floor in our guideline. We have Luderm, Compil. So gel foam. This is used for the when severe moderate to severe exuding wounds. It has a hybrid fiber. Indicated for medium to heavy exuding wounds, not on dry wounds, and effective when the wound exudates, slowly absorbing fluid, leading to a change in the physical state of the dressing, transforming into a gel. So at first you will see it's like a fiber, but then when it's soaked, it will transform into gel. The dressing provides an environment for rapid debridement and an initial increase in size or depth of the wound, therefore often occurs. Guidelines for use. When packing a wound with a ribbon, it must be very lightly packed to avoid further trauma. This is minimal lateral wicking, therefore it can overlap healthy skin slightly. Wicking is like a sore. And then if dressing is not in gel form, then it should be moistened before moving. Not compatible with ointments and so these are the examples of gel form. We have the Axel. You. So we have hydrogel polymers with high water, suitable for wound debridement and for light experiments. Dress products either the release of water to rehydrate, ceramic tissues for the absorption of exudate from the wound, release moisture. Agents in autolytic debridement or sloppy or necrotic tissue. So the risk is the very wound will become macerated. So that's protected. Let's protect to make it happen. Hydrogel. It is contraindicated in wounds without vascular supply. And then it aids in autolytic debridement on sloppy and necrotic tissue. Guidelines for use. Apply to the wound. Requires a secondary dressing which will encourage occlusion. Example is the film or adhesive foam dressing. Should not be used in fragile skin. Observe very wound skin for maceration. So we have the Medihoney as an example of this, and Dorm gel. Film or composite dressing. Transparent polyurethane dressing suitable for flat or shallow low exudate wounds. Sterile, thin, waterproof, self-adhesive, semi-permeable film protective layer. It can be used as a retention dressing aid alone. Some permits visualization of the wound. Some patients may be allergic to the adhesive. So one example of this are the Tegaderm. So we have this other one. These are transparent. It looks like this. It's applicable only for the dry one. We also have some antimicrobial dressing. So we use silver, honey, iodine, broad spectrum antibiotic, useful for the short-term management of bacteria in healable wounds, can be used for longer periods in maintenance wounds. So we have sheets, gels, paste, or hydrofiber forms. And these are the examples. So we have Vicodin, we have Medihoney again, Silver Cell, and these are my antimicrobial dressings. So we also have other absorbing dressings. So there are also ones which are very has a foul odor. So this dressing will absorb the odor of the wounds. It is a secondary dressing used for malodorous and infected wounds. Contains odor absorbent charcoal within the product. And Carboflex has an alginate wound contact layer and carbonate layer for odor absorption. It is particularly useful dressing for fumigating malignant wounds. Some of these products are inactivated by moisture. So these are the products we have. We have Actisorb Plus, Carboflex, and Actisorb Silver. So this they have a charcoal product inside. Indicator is primary barrier against body fluids. These are the dressing that a product that protect our skin. The primary barrier against body fluids for improved continence care. I know you have idea what this. And then protective barrier to protect against adhesive medical devices, skin protection around stomatitis, area wound protection from accidents. What they think are these products? Allow the product to dry completely before applying pads or clothing. Applying too many layers or product may make the area feel stiff. Use of the product with other barriers, ointments, creams, or lotions may significantly reduce its effectiveness. Not to be used in affected areas of the skin, for example, in fungal infections. So these are the products that protect our skin. We have the Covalent cream, Covalent spray, advanced therapies. So these are the example of our advanced therapies. So we have the negative pressure wound therapy, the wound vac. We also have the maggot therapy. This is biological. This maggot used for debridement of skin. So one of the example for the debridement is biological. Compression bandaging, collagen, and Flexiseal. So this is our Flexiseal. So that's it. After you do the wound care, you have to document it. Thank you. Do you have any questions?
Gracias.